Hi, and welcome to the podcast series Proctology and Laparoscopic Surgery. This is Dr. Ranjan Tripathy, your minimally invasive surgeon and proctologist with you. Today we are going to talk about hemorrhoids, which is a very common problem in India. Before starting, I would just like to highlight some important facts and figures about hemorrhoids in India. In India, approximately 4 crore people are suffering from hemorrhoids in various degrees, and every year about 1 million new cases are reported. This incidence rate increases with age, and the most vulnerable age group I would say is between 45 to 65 years of age, although it can affect anyone. So let's start to know more about hemorrhoids. Hemorrhoids are also known as piles commonly, like most of you know. They're actually part of a normal anatomy. Every single person listening to this podcast has hemorrhoidal tissue, whether you know it or not. Most of the time, you don't even know that you have them. They are part of a normal anatomy of the lower rectum and anal canal. And really, what they are is a conglomeration of blood vessels that sit in the anus. So they are there for a normal function, usually providing cushion to the lower anal canal. Hemorrhoids are swollen veins located around the anus or in the lower rectum. They are soft, fleshy lumps that form inside and just inside the anus. They easily bleed during bowel movements if they are bigger in size. Though they are not usually painful, they can cause itching and discomfort. If the lumps grow, they can protrude outside through the anus in a condition which we call it prolapsed piles. Patient can usually feel the lump while cleaning themselves. Hemorrhoids generally develop gradually over a lengthy duration of time and are often related to constipation and straining at motions. Sometimes the condition is genetic and made worse during pregnancy. So I get a lot of people that will go online and they will have some anal rectum complaints, and one of their very first things that come up is hemorrhoids. And one of the first things that you will see is external hemorrhoids versus internal hemorrhoids. What's the difference between the two? If you ask me, internal hemorrhoids are, as the name states, inside the anal canal. They are internal, so those are usually cushions of blood vessels that are not able to be seen by the naked eye. Usually, they are the cause of rectal bleeding. They can cause pain sometimes if they swell and bulge, and like I said, can prolapse outside the anal canal. External hemorrhoids is what we can see from outside. They are very common and most troublesome. Usually, they have a lot of skin component. They usually cause pain, severe itching and difficulty while sitting. But fortunately, they are very easily treated. About 50% of adults experience the symptom of hemorrhoids by the age of 50. Let's take a step back and we'll go back to the symptoms that patients go through. Irritation and pain around the anus, mild to extreme itching around the anus, itchy or painful lump or swelling near the anus, sometimes involuntary fecal leakage, painful bowel movements, and blood on the tissues after having a bowel movement. And very severe cases, frank bleeding per anal. Although hemorrhoids are painful, they aren't life-threatening and often go away on their own without treatment if they are very small in size. If you have them often, you may develop symptoms of anemia or low hemoglobin and weakness, pale skin due to blood loss in severe cases. Now comes the most important part. When do you need to see the doctor? There is no need to be panicked about hemorrhoids if at all you experience any of these symptoms. But when the patient or any of you is having rectal bleeding, we do recommend that you come to see us or any doctor because it's very well and may just be hemorrhoids. But You need to have a trained professional proctologist or a colorectal surgeon, if you will, or even your family doctor. Really investigate that, because even though the hemorrhoids do bleed and it's a major cause of anal or rectal bleeding, there could be other causes that we must first rule out. What scares patients most, especially our friends who research a lot online, is, are hemorrhoids cancer, or can they turn into cancer? The answer is no. Hemorrhoids are not cancer. Hemorrhoids do not turn into cancer. But what I want to emphasize is, many patients have been told they have hemorrhoids, or potentially just chalk up their symptoms to hemorrhoids, and they may be missing a more serious diagnosis of rectal cancer or anal cancer. The key lies in proper evaluation and diagnosis. Usually, the conditions can coexist in some group of people, but hemorrhoids are not cancer and they do not turn into cancer. So, what causes hemorrhoids? Many things. Multifactorial, we like to say. I tell a lot of my patients sometimes hemorrhoids are just the act of one's aging process, where the hemorrhoids themselves are getting loose and they tend to have the effects of gravity like other body parts. We do see hemorrhoids in very young people as well, and I think one of the most common causes of hemorrhoids is a lack of a good diet and exercise. What I mean by that is, people who don't have a good dietary intake of fiber tend to be constipated, tend to spend a lot of time on the toilet, and a lot of times straining on the toilet to get a bowel movement to come out, and those definitely precipitate hemorrhoidal disease. Now let's focus in a little bit about treatment, or even first prevention of hemorrhoids. To prevent or avoid worsening hemorrhoids, like I told, we need to avoid all these precipitating causes like I just discussed. Most important being, avoid straining during a bowel movement. Also try to increase your water intake. Drink enough water can keep your stool soft, help it in easy passage. Use the restroom as soon as you feel a bowel movement coming on to prevent hemorrhoids from developing. Exercise regularly to prevent being constipated, and don't sit for long periods, especially on hard surfaces like concrete or tile. Consuming foods that are high in dietary fiber can minimize the risk of developing hemorrhoids in future. Good dietary fiber sources include whole wheat, brown rice, oatmeal, pears, carrots, buckwheat, bran. Dietary fibers helps create bulk in the intestines, which softens the stool, making it easier to pass. Briefly, I would highlight the treatment part of hemorrhoids. In majority of cases, simple measures will alleviate symptoms, while hemorrhoids get better without treatment. However, medicines and even surgery may sometimes be needed. The common home remedies to alleviate pain, swelling and inflammation around the hemorrhoids are eating high fiber foods, like I mentioned, more fruits, more vegetables, whole grains, using topical treatments like an over-the-counter hemorrhoidal cream, suppository contain hydrocortisone, or pads containing a numbing agent. What I would like to emphasize here is, most of these soothing agents or topical agents need to be applied prior to passing the motions, so that there is no undue force or effect on the hemorrhoids, precipitating a bleeding. Soak regularly in warm water bath, which we call as cis bath. It gives a lot of relief from pain. We ask them to sit in a tub of water for around 10 to 15 minutes, which relaxes the muscles of the anal region. And sometimes if pain is more severe, we ask them to take oral painkillers like a Brufen or a aspirin or a paracetamol for the same. With these treatments, hemorrhoids symptoms usually go often with a week. See your doctor in a week if you don't get relief, or sooner if pain and bleeding increases. Now, what are the non-surgical treatment options? The most common type of non-surgical hemorrhoidal treatment is rubber band ligation. This is usually an outpatient procedure for small internal hemorrhoids, where an elastic band is placed on the base of the hemorrhoid to cut off the blood supply. The hemorrhoid either shrinks or falls off. Another procedure is sclerotherapy, where a solution is injected into an internal hemorrhoid. But with the advent of laser, usually rubber band ligation and sclerotherapy are not very much practiced in today's era. What we want to know, or most of you will be curious to know about, is the surgical management part, because that usually comes with a lot of scare to most of our patients. So surgical treatment may involve a complete removal of the hemorrhoids, known as a hemorrhoidectomy, nowadays reserved for only very huge and bleeding hemorrhoids. The two common procedures which are usually performed as a surgical technique nowadays is, one is a laser hemorrhoidoplasty, which I'll be presenting a separate podcast subsequently. Other is the stapler hemorrhoidectomy, wherein we do a stapling technique and remove the entire blood supply from all the possible sources of hemorrhoidal tissue. Now, coming to laser surgery for piles, planning for a laser treatment or laser hemorrhoid surgery will cure painful hemorrhoids. Changing lifestyles and home remedies are not enough to comfort larger painful hemorrhoids or piles. When someone has crossed years of discomfort, surgery is the only option to treat the piles. Even surgery is also available, and it has its own advantages and disadvantages. So, to wind up, some last take-home points about hemorrhoids. With proper treatment, most of you are likely to experience an improvement. Following your doctor's directions and maintaining a regimen, including exercise, avoiding sitting for prolonged periods of time, there will be a lot of reduction in the hemorrhoidal symptoms, and it also improves your outlook. As and when required, consult your doctor. Depending on your symptoms, depending on your trouble, go for the best possible treatment. We are always ready to help you at any time. This is enough to know about hemorrhoids. I hope you have had a better understanding of it this time, and have no fear about the hemorrhoids. Thanks for patiently listening to me. I'll be back soon with another episode on proctology and laparoscopy. Once again, this is Dr. Ranjan Tripathy signing off. Thank you.